What if your own body was trying to send you a message? A quiet whisper about your heart. But you were unknowingly missing the signs. It's a painful reality that as we gracefully move past 60, many of us start to feel little aches, new kinds of tiredness, or just not quite right moments. And all too often, we dismiss these subtle shifts as simply getting older or just a part of aging. We tell ourselves it's nothing to worry about, that everyone feels a bit more tired or achy. But here's the surprising truth sometimes. These seemingly innocent symptoms aren't just about age. They can be your heart, the very core of your vitality, trying to tell you it needs a little extra attention. The secret is that heart trouble doesn't always announce itself with a dramatic chest clutch like in the movies. Instead, it often shows up in strange, unexpected ways that can easily be overlooked. In this video, we're going to uncover 6 of these strange, often dismissed symptoms that could be quietly signaling trouble with your heart, especially if you're over 60. Understanding these clues could make all the difference for your health and your peace of mind. Make sure you stay with me until the very end, because I'll share something crucial that might just surprise you and change the way you think about taking care of your heart. Let's dive right in and talk about the very first symptom that often catches people off guard: persistent, unexplained fatigue. Now, I know what you might be thinking. Of course, I'm tired. I'm over 60. And it's true. A certain amount of tiredness is normal as we age, but I'm talking about a profound, overwhelming exhaustion that simply doesn't go away, even after a full night's sleep or a quiet day of rest. It's the kind of fatigue that makes everyday activities feel like climbing a mountain. You might find yourself too drained to do things you once loved, like gardening, going for a walk, or even just having a conversation with friends. This isn't just feeling a bit sleepy. It's a deep, bone-weary exhaustion that impacts your ability to live your life. What makes this symptom particularly strange is how easily it's dismissed. We often attribute it to stress, poor sleep, or simply the natural process of aging. We push through it, perhaps thinking we just need more rest or a different vitamin. But for your heart, this kind of relentless fatigue can be a critical signal. When your heart isn't pumping blood as efficiently as it should, your vital organs and muscles aren't receiving enough oxygen and nutrients. Imagine a car engine running low on fuel. It just can't perform properly. Your body reacts by diverting blood away from less critical areas, like your limbs, and towards your brain and other essential organs. This reallocation of resources, combined with the heart having to work harder, leaves you feeling utterly drained. It's your body's way of saying, slow down. Something isn't right. Take Sarah, a lively 68-year-old who loved her morning walks and tending to her rose garden. Over several months, she noticed she was just too tired to do these things. She'd wake up feeling as if she hadn't slept at all. She dismissed it as stress from a family issue. But the fatigue persisted even after the stress eased. It wasn't until she mentioned it to her doctor during a routine checkup that they started looking deeper, eventually discovering a heart issue that was causing her extreme tiredness. The key here is persistence and the lack of an obvious explanation. If you're experiencing this kind of fatigue, especially if it's new and doesn't improve with rest, it's worth a conversation with your doctor. It's not just about feeling tired. It's about your body signaling a fundamental issue with its energy supply. Now, let's move on to another often overlooked symptom: swelling in your feet, ankles, or legs, also known as edema. This one can be particularly sneaky because, like fatigue, it's often attributed to other causes. You might notice your shoes feel tighter at the end of the day, your socks leave deep indentations, or your ankles look puffy. Many people assume this is simply due to standing for too long, hot weather, or perhaps a minor strain. Some might even think it's a common side effect of certain medications. And while these can certainly be reasons for swelling, when it comes to your heart, this kind of fluid retention is often a telltale sign that your heart isn't pumping blood effectively. When your heart struggles to pump blood, especially from the lower extremities back up to the chest. Gravity takes over. The blood starts to back up in the veins, leading to fluid leaking out of the capillaries and accumulating in the surrounding tissues, typically in your feet, ankles, and legs. This is particularly noticeable in the evening after you've been on your feet all day. Imagine a clogged drain. The water has nowhere to go but to back up. Your circulatory system works similarly. If your heart, the pump, isn't strong enough, fluid can linger where it shouldn't. David, a spry 72-year-old, loved to take long walks with his dog. He noticed his ankles were consistently swollen by the end of the day, making his socks feel uncomfortably tight. He brushed it off, thinking it was just a result of his daily walks or perhaps the warmer weather. It wasn't until the swelling became more pronounced and he started feeling short of breath climbing stairs that he finally spoke to his doctor. His doctor quickly identified the swelling as a symptom of his heart struggling to keep up with his body's demands. While elevating your legs can offer temporary relief, and reducing your salt intake might help, if you're consistently noticing unexplained swelling, especially if it's accompanied by other subtle symptoms, it's a significant indicator that your heart needs to be checked. Don't simply attribute it to aging or minor causes. Your body is holding onto fluid for a reason, and that reason could be connected to your heart's ability to do its vital work. Now that we've looked at persistent fatigue and swelling, let's turn our attention to another surprising indicator that might seem completely unrelated to your heart: unexplained jaw, neck, or even back pain. When most people think of heart attack symptoms, they picture a crushing chest pain, perhaps radiating down the left arm. But for many, especially women, heart trouble can manifest as pain in less obvious places. You might experience a nagging ache in your jaw, a stiffness in your neck that just won't go away, or even discomfort in your upper back or shoulders. This pain might not be intense, but it's unusual, and it might come and go, perhaps feeling worse with exertion or stress. What makes this strange is how easily it's mistaken for other common ailments. You might blame it on a dental issue, a strained muscle from sleeping awkwardly, or simply arthritis in your back. Many people will visit their dentist, chiropractor, or physical therapist before ever considering their heart. The reason for this referred pain is fascinating. The nerves that supply your heart can also connect to other parts of your body, including your jaw, neck, and back. When your heart is in distress, these nerves can send pain signals that are interpreted by your brain as coming from these other areas. It's like your body's wiring system is a bit crossed, misdirecting the alarm signal. Maria, a vibrant 65-year-old, started experiencing a dull ache in her jaw. She attributed it to her grinding her teeth at night or needing a new dental crown. She spent weeks trying home remedies for jaw pain, never realizing it was her heart subtly calling for help. It was only when she also began feeling unusually tired and slightly breathless during her usual walks that she consulted her doctor, who, after a thorough examination, linked all her symptoms back to her heart. If you're experiencing new, unexplained pain in these areas, especially if it seems to come on with exertion, stress, or alongside other subtle symptoms like fatigue, it's crucial to consider your heart as a potential source. Don't dismiss it as just another ache of aging. It could be your heart sending you a very important, if indirect, message. Next, let's talk about a symptom that specifically affects your breathing, but isn't just common shortness of breath with exertion. Shortness of breath that gets worse when you lie down. This symptom, medically known as orthopnea, is a powerful indicator that your heart might be struggling. While it's normal to feel a bit winded after a brisk walk or climbing a flight of stairs, orthopnea means you start feeling breathless or have difficulty breathing specifically when you lie flat. You might find yourself needing to prop up more pillows to sleep comfortably, or even waking up in the middle of the night gasping for air. Some people even find relief by sitting upright on the edge of their bed. What makes this symptom strange is its specific correlation with body position. You might breathe fine when sitting or standing, but the moment you lie down, the struggle begins. This often leads people to blame allergies, asthma, or even a stuffy nose, rather than their heart. The explanation for orthopnea lies in fluid dynamics within your body. When you're upright, gravity helps keep fluid in your lower extremities. But when you lie flat, that fluid redistributes throughout your body, including your lungs. If your heart isn't efficiently pumping blood away from your lungs, this redistributed fluid can build up, essentially causing congestion in your lungs. This makes it harder for your lungs to expand fully and for oxygen to be absorbed, leading to that gasping sensation. Think of it like a sponge that's slowly soaking up water. Eventually, it becomes too heavy and compressed to function properly. Arthur, a 70-year-old retiree, started noticing he needed 2 pillows, then 3, to get a good night's sleep. He thought he was developing sleep apnea or just had a persistent sinus issue. He'd even try nasal sprays, which, of course, offered no relief for his breathing problems that were actually coming from his heart. It wasn't until his wife noticed him frequently waking up gasping that they realized something more serious was going on. If you find yourself consistently needing to use more pillows to breathe comfortably at night, or if you ever wake up feeling suffocated, this is a clear signal that demands immediate medical attention. It's your heart telling you it needs help managing the fluid balance in your body. Moving on. Let's discuss another symptom that frequently gets mistaken for something else entirely, a persistent cough or wheezing. This isn't just your typical cough from a cold or seasonal allergies. We're talking about a nagging cough that just won't go away, often lasting for weeks or even months, and sometimes producing frothy white or pink-tinged mucus. You might also notice a wheezing sound, similar to what someone with asthma experiences. What makes this strange is how commonly it's attributed to respiratory issues. Many people will try over-the-counter cough medicines, allergy pills, or even be treated for bronchitis or asthma, without ever considering that their heart could be the underlying cause. The connection here, once again, comes back to fluid. When your heart is weakened, it may not be able to pump blood forward efficiently. This can cause blood to back up in the veins that carry blood from the lungs to the heart. As a result, fluid can leak into the air sacs of the lungs, leading to pulmonary congestion. This fluid buildup irritates the airways, triggering a persistent cough. The wheezing might occur as the airways narrow due to inflammation or fluid. It's like trying to breathe through a damp cloth. It creates resistance and a whistling sound. Eleanor, a 67-year-old, had a persistent cough for almost 6 months. She'd always had mild allergies and assumed it was just a bad allergy season or a smoker's cough. Even though she'd quit years ago, she tried various allergy medications and even an inhaler prescribed by an urgent care clinic. But nothing really helped. It was only when her cough became more severe, and she started feeling more tired and a bit short of breath, that her doctor suspected her heart. A simple chest X-ray and subsequent heart tests revealed that her heart was indeed struggling, and the cough was a direct result of fluid backing up into her lungs. If you have a chronic cough or wheezing that doesn't respond to typical treatments for colds, allergies, or asthma, and especially if it's worse at night or when lying down, it's definitely a symptom you need to discuss with your doctor regarding your heart health. It's not just a cough. It's a potential cry for help from your circulatory system. Finally, let's explore a symptom that can significantly impact your daily life and often gets attributed to age or digestive problems, feeling sick to your stomach, or experiencing a loss of appetite. This involves more than just an occasional upset stomach. It's a persistent feeling of nausea, a sense of fullness after eating very little, or a general disinterest in food, leading to unintended weight loss. What makes this strange is that it seems so far removed from the heart. Most people would immediately think of stomach bugs, food poisoning, or perhaps a side effect of medication. They might even assume it's just a natural part of getting older where your appetite lessens. However, When your heart isn't pumping blood effectively, it can significantly impact your entire digestive system. Here's how it works when the heart is weakened. It prioritizes sending blood to the most critical organs like the brain and kidneys. This can mean that less blood flows to your digestive system. With reduced blood flow, your stomach and intestines don't function optimally, leading to feelings of nausea, bloating, and early satiety. Furthermore, the fluid retention that can occur with heart issues can also cause swelling around the liver and intestines, putting pressure on your stomach and making you feel full very quickly. Even if you've barely eaten, it's like your digestive system is being told to slow down because the main engine isn't supplying enough power. Robert, a 75-year-old, started losing weight because he just never felt hungry. When he did eat, a few bites would make him feel uncomfortably full and nauseous. He thought he might have a stomach ulcer or that his taste buds were just changing with age. He tried eating smaller, blander meals, but the issue persisted. It was only when his doctor noticed his unexplained weight loss and asked about other symptoms that the connection to his heart was made. The nausea and loss of appetite were direct consequences of his heart's reduced pumping ability. If you're experiencing persistent, unexplained nausea, feeling full after eating very little, or an overall loss of appetite leading to weight changes, and especially if these symptoms appear alongside any of the other subtle signs we've discussed, it's a strong signal that your heart needs a closer look. Don't just attribute it to stomach issues or aging. Your digestive system could be reflecting a deeper circulatory problem. We've talked about that creeping fatigue that just won't quit, the mysterious swelling in your ankles, those unexpected aches in your jaw or back, the struggle to breathe when you lie down, that nagging cough, and even that strange loss of appetite. It's natural to feel a little worried hearing all of this, but my intention isn't to alarm you. It's to empower you. Knowledge is your greatest ally here. Your heart has been working for you your entire life, pumping tirelessly, sending life to every corner of your body. Now, as you navigate life after 60, it's more important than ever to listen carefully to what it might be trying to tell you, even if the messages are subtle or seem a little strange. Remember, catching these signs early can make all the difference in preventing more serious complications and ensuring you continue to live a full, vibrant life. Your body is incredibly resilient, and it often gives us whispers before it starts to shout. Learning to recognize these subtle whispers, rather than dismissing them as just getting older, is a powerful act of self-care. It's about trusting your instincts, being curious about changes in your body, and, most importantly, having open and honest conversations with your healthcare provider. Don't hesitate to voice your concerns. Even if they seem minor or unrelated to your heart, it's always better to be proactive and informed. Small changes in how you perceive these symptoms, coupled with regular checkups and a commitment to a heart-healthy lifestyle, which includes things like a balanced diet, gentle movement, and managing stress, can significantly improve your cardiovascular health. It's about building a partnership with your body, where you listen and respond to its needs. Think of your annual physicals not as a chore, but as a crucial conversation with your doctor where you share any and all new symptoms, no matter how insignificant they might seem. Your doctor is your partner in this journey, and the more information you provide, the better equipped they are to help you. So, what resonated most with you from today's discussion? Have you or someone you know experienced any of these symptoms and perhaps dismissed them? Share your thoughts and experiences in the comments below. Your story could genuinely help someone else who's feeling the same way. We're a community here, learning and growing together. And if you found this video helpful and informative, please give it a thumbs up. That tells me to create more content like this for you. And don't forget to subscribe to the channel and hit that notification bell, so you don't miss any of our upcoming videos designed to help you live your best, healthiest life at every age. Your health journey is a marathon, not a sprint. And every small step you take to understand your body better is a step towards a longer, more vibrant life. Remember, age is just a number, but vitality is a choice you make every single day. Keep listening to your body. Keep caring for your incredible heart. And keep living your best life at every age.